Good evening, everyone, and welcome to One Healthy Boston's Facebook Live. I'm Kristen Perfettio. As a secondary wave of COVID-19 cases sweeps the country, testing remains an invaluable tool for keeping our communities safe and healthy. South Shore Health is offering rapid testing at Health Express. They're offering it at two locations, at Abington and Braintree. Those urgent care centers are giving patients access to quick and reliable results. Tonight, I'm joined by Dr. William Tollefsen, our newly named Vice Chair of Emergency Medicine and Urgent Care at South Shore Health. He's here with us today to talk about COVID-19, how rapid testing works, and the ways Health Express urgent care centers are providing patient comfort and safety during this ongoing pandemic. Dr. Tollefsen, welcome to One Healthy Boston.
Appreciate it.
We are so happy to have you here tonight. Before we begin, I would like to just get a snapshot, if you will. What are some of our healthcare providers seeing as far as COVID-19 cases right now? Are we indeed starting to see evidence of a surge, and are we not?
Yeah, absolutely. Right now, we are definitely experiencing a surge. It's not the same volume that we saw in April, May, but it's been a very steady climb of COVID cases, influenza-like illness. That's kind of gradually grown and grown, and as that incidence of illness has grown, we've seen an increase in our hospitalizations. And with the increase in hospitalizations comes increase in the need for ICU level of care and ventilator management. So we are definitely starting to see that uptick as we see the uptick in our communities.
Okay. And is there a difference between the patients that you're seeing now and the severity of patients that you were seeing back in March and April? Are symptoms different or less long lasting, I should say?
Yeah, I think the symptoms are very, very similar. They're the same. The disease hasn't changed. I think what's changed is our ability to manage it. We have a much better idea of what we're dealing with now. We have some additional therapies that we can initiate. And quite honestly, we know what we're dealing with because now we have much better testing. Previously, a patient would come in, influenza-like illness, looked like they had COVID, were either ill to the point where they needed hospitalization or could manage at home. And it was a presumed diagnosis, and we wouldn't get that result for sometimes 7-8 days. And that by that point, the people would recover or they wouldn't, and the presumed diagnosis was made, and you would treat empirically.
Our audience is very interested in tonight's topic, which again is about rapid testing and COVID-19. I want to start with our first question from Fallon. He says, or he wants to know, is it normal to test positive after completing a quarantine? And if this happens, what should you do?
Yeah, so that's a great question. And could you test positive after quarantining? You certainly can, and it again depends on the level of virus in your body. We could have remaining, let's say you had COVID, you had influenza-like illness, you quarantined, you got better, but you retested yourself and it was a PCR test, which can find very, very small, minute nucleotide. And what could possibly happen is you're still detecting essentially very low levels of nucleotide from the RNA of the virus that is still in your body and subsequently give you a positive result. Does that mean that you are still contagious? We still don't know. It's still a positive, and we're hopefully getting more and more details as studies go on about that.
Okay, so if that happens, if you are testing positive, what should someone do? Should they still continue to isolate and quarantine until they get a negative test altogether?
Yeah. At this point, not knowing all the full details of the virus, the best advice is if you continue to test positive, could you still be shedding virus? Could you still be contagious? And that's where it's best to stay quarantined.
Okay. Julie wants to know, could you please explain, and I just lost my question. Hold on one second. Please explain the types of rapid testing that actually exist.
Yeah, Julie, that's a good question. There's essentially two um, two rapid tests that we see in the market today. There's what's called antigen testing, which tests for a particular antigen or a finding on a viral protein that's found on the surface of the protein of the virus, that it tests for the presence of that. And then there's also the rapid molecular tests, which are looking for actual nucleotide. Again, those DNA fragments that we see, that we look for in the kind of the longer send out versions of these tests. Um, each have their own sensitivity and specificity. I mean, can they rule in a virus or infection, or can they also rule it out? And the antigen test has less sensitivity and specificity, and that's why you may see some schools or other institutions not necessarily accepting that test, and it might be good for screening. And many times it'll be associated with a PCR. So you do a rapid antigen test, and you get a negative result, then that sample also then gets sent out for a PCR, where you might get a result in 4 or 5 days as negative. Of course, if you're positive, that's a very good test to say you're positive. You're positive.
Okay. All right. That leads to Henry's question. I think you touched upon this. Are rapid tests as good as sort of the slower tests, if you will?
They're very good. The antigen test, as I suggested, maybe have a little bit less sensitivity and specificity. Tests like the Abbott ID Now test is again a nucleotide-based test, testing for that presence of viral DNA, and has up to 96-98% sensitivity specificity. And at this point has even been approved by DESE, which is the educational state educational bodies requirements to return to school and things like that. So it is very good.
Okay. Diana wants to know, what testing does the state use, or what are their recommendations?
Yeah. So I think when you say the state, you might be referring to the state lab, which was actually the only lab that we had access to in the very beginning. And that is what's called a PCR, or polymerase chain reaction, which is a type of test where the actual DNA of the virus is amplified to find a signal. That's really the gold standard testing, but that's also come into some questions of, to the previous person's question about if you're completed but you still test positive. To what point is it too sensitive, where we're not really identifying patients who are infective?
Okay. I'm sorry. Nancy would like to know, can someone who already had COVID-19, is it possible that they can get it again? Have you seen cases like that yet?
Yeah, we've had several cases like that, where we had known positive COVID and now subsequent reinfection. So it has been described, and now we are seeing it in our state.
Okay. People who are looking to get a rapid test, or any test in general, where should they go and how should they start that process?
So yeah, rapid testing is usually available at urgent care. South Shore Health Express urgent care centers in Abington and Braintree have the capability to perform rapid Abbott ID Now testing, which is the nucleotide test that I spoke about previously. And that is a resource for testing. Other tests are available. They're not usually the rapid tests. So if you had an exposure or need rapid testing, South Shore Health Express is a resource for you.
Okay. What steps do people need to do in order to get a test? Is there something that you have to do to prepare? Just asking.
Yeah. No, I think so. I think the first and foremost is you have to have your expectations. Not all tests are created equal, and there isn't, unfortunately, ubiquitous access to these tests. The supply chain is brittle for the reagents that are used. So there's a limited number of tests that are available, and the centers and testing centers rapidly go through their inventory because we're trying to test as many people as possible. So you need to have good expectations that it's not always ubiquitously available. There's varying degrees of sensitivity and specificity, which you should ask your provider about, and also be willing to accept that there might be some turnaround time if it needs to be sent to a lab. Particularly if you need testing for travel reasons or exposure, or even if you're symptomatic, you might have to wait a day or two for that final result. Of course, everybody wants to know right away, but if you're symptomatic, you need to stay home anyways.
Okay. When someone gets a rapid test, and I know you said there could be a wait time, but generally, how quick do they get those results?
Well, a rapid test, we get results in 15 minutes.
Wow, that's pretty amazing. And again, so convenient to just call and make an appointment, correct? Do you have to do any type of questionnaire with doctors beforehand before being seen?
Yeah, it's really easy. Actually, you can you can just log on to the website, South Shore Health Express website, which is southshorehealthma.org. And on that website, you can actually schedule an online appointment where, once scheduled, you have a very brief telehealth visit with a provider to gauge an understanding of your symptoms or your current experience. And that way you can make sure that you're referred to the most appropriate testing at that time. At which point, once that's done and the order is placed, we are able to get you to one of our testing sites where the sample is taken. For all these tests, you may have heard of the kind of the joke, the brain biopsy, or the deep dig in your nose for a sample. These are all anterior nares, so it's just right to the tip of your nose, and you don't need to go digging deep. Certainly, that's a concern of a lot of people who might have had a previous test like that, or children as well. It's a much easier sample now.
Terrific. Rodriguez at home wants to know, what exactly would you consider a mild case of COVID-19, and is it somehow different?
So, a mild case of COVID-19 would be that your classic influenza-like illness. It's body ache, malaise, sore throat, maybe low-grade fevers. You're able to manage at home with Tylenol. You're able to continue to drink fluids and stay hydrated. And those typically only last a few days and gradually improve, just like a run-of-the-mill flu. Those are very mild cases.
Are you seeing a lot of cases where people are testing positive for COVID-19 but have no symptoms at all? I'm thinking kids are probably that group, right?
Yeah, and so that when we do some surveillance testing, particularly in the hospital setting, if you're being admitted to the hospital or you need, say, you're coming in to have an orthopedic surgery or some type of elective, we require testing before you come in, and you're completely asymptomatic. You feel fine, and you test positive, and that's that was the scary thing back in the spring when we discovered that you could have indeed asymptomatic spread. That's what really changed the game, and that's what's really driving a lot of our numbers right now, is that asymptomatic person who feels fine, who then is able to spread the virus.
Okay. Megan wants to know, do we have a therapy to help people recover?
So we have several therapies. They're all emergency use authorized by the FDA. Remdesivir is a antiviral medication that we do give to patients in the hospital who require hospitalization for COVID-19 infection. There's also been promise for other therapies, including dexamethasone and other antibody treatments are kind of slowly coming into view. But we do, and we certainly have more actual therapies that are directed towards COVID-19. But listen, that's in addition to all the other supportive measures that we're able to do.
Okay. I'm here with Dr. William Tollefsen, our Vice Chair of Emergency Medicine and Urgent Care at South Shore Health. The topic tonight, this evening, is COVID-19 and testing, rapid testing, PCR testing. He's doing his best to answer any questions you may have regarding that particular topic. Annie would like to know, Dr. Tollefsen, how long should people wait to get retested after an initial positive test and quarantine?
Annie, I thought you were going to ask how long should you wait to get tested after you had an exposure?
Well, both good questions.
That's a really good question, and I'll answer my question first, Annie. And it's about 72 to 96 hours, because if you were exposed, and you say you got a phone call from somebody or from DPH contact tracing, and they said you've been identified as an exposure. It happened, an hour ago, a day ago. It takes time for you to develop enough viral load that it'll be identified on some of these tests. So, if somebody coughs in your face and it turns out they have COVID and you run and go get a test, it's going to be negative, and that test it won't be beneficial to you or to the community. So, that being said, to answer your question, after you have a positive test, if you continue to quarantine, socially isolate, you become asymptomatic, you are at that about 10 to 14 day point. There really actually isn't enough much evidence to say you need to have repeat testing to say that you're negative. Most of the evidence would say you're no longer contagious. But again, if you need it to prove for work purposes or travel purposes, that's probably the time point of after you've been asymptomatic, fever-free for about 4 days.
I think a lot of people have been fatigued at staying at home and are looking to eventually travel, and the holidays are coming. Kristen at home has asked, should someone who had COVID-19 and has recovered take any special preparation or precautions prior to traveling? And is there anything different that they should be doing as they make those plans or when they travel?
Yeah, I mean, you should focus on making sure that you don't get it again, because even though you've had it, there's no immediate evidence to say that you can't get it again. And we've seen people with recurrence of COVID-19 in our community. So just like anybody else at this point, you've had it. You are no longer someone who can infect somebody else with it, but you need to make sure that you don't get it again, and that you maintain social distance, that you wear a mask, you wash your hands, you clean surfaces, you only really interact with your immediate family, not your, kind of shut down that social circle. And this is particularly important. I think we all got pretty lucky over the summer, where the incidence of the disease was quite low in our community. In fact, we had zero cases in the hospital, and it was great. We still saw every now and then a case, but the incidence in our community was very low, and we got lucky. But now, with the incidence of the disease being much higher, with that known asymptomatic spread, we're all getting COVID fatigue. We're all, believe me, we're all getting it. But now that we have the double whammy of COVID fatigue, that triple whammy, COVID fatigue, holidays and want to travel, and a high incidence of disease that's rising, it's a perfect storm. So I urge you to try to stay home, do the virtual Thanksgiving, and try to protect yourself and your family. And by doing so, you protect your community.
Yeah. We've gotten a question about antibody testing. What do you know about that?
So antibody testing came out probably April, May or something in that time period. And it's basically, you can get an antibody test that says that you had COVID or not. You have an antibody to COVID, meaning your body has generated a protein that identifies the fact that you've been exposed to COVID. That's all it says. I mean, it really doesn't mean much more than that. Unfortunately, it's a yes or no. It doesn't give you a level, and it doesn't give you, and we don't know what level would even confirm immunity. The hope is that someday we do know that you can get antibody testing to say that you have immunity to COVID-19 because your antibody titer, or the level of the antibody in your system, is met a certain level. We can do that right now for varicella, which is chickenpox. We do that for hepatitis B, and alike. But right now the antibody test, while available, doesn't really doesn't really help. Doesn't really give you much information.
Okay, thank you for clearing that up. We have a question at home about rapid tests and the cost. Is there ever a moment where rapid testing might be free?
I think rapid testing at this point, again, the supply chain issues are a major factor with the rapid testing. If you're symptomatic, insurance does cover it. Um, there are other testing options through the state with Stop the Spread that are free, but again, they're not rapid.
Okay. I know you touched upon this earlier, but I think it's helpful for our audience to hear it again. Are all tests given the same way? And are there, I guess, like the flu shot, are there any easier versions, especially when it comes to testing your kids?
Yeah, I think we're lucky now that it's an anterior nares, so the front of your nose test swab, so it's a lot easier, particularly when we're talking about trying to test your kids. Um, I could imagine trying to test my son; it would be difficult trying to get a deep swab. So that's a benefit that we're already seeing right now. Other than that, it is continues to be the swab test or a buccal test, which is the inside of your cheek. Some of the antigen tests are the inside of your cheek, but those are the ways we obtain the samples at this point.
We've gotten a lot of comments from viewers who are really questioning the severity and the reality of the COVID-19 virus. Now, you've been working for 6, 7, 8 months now on the front lines of this. What's your message to people at home who are actually doubtful of this?
Yeah, it's well, it's unfortunate because it's real. It's very real, and it's devastating. It's devastating. It's it's going to hit every single one of us in one way or another. My uncle died of COVID-19 in the spring, and I think part of the reason why there may be this disbelief or this feeling that maybe it's not as bad is because right now health systems like ours are doing everything we possibly can to protect our patients and to protect the hospital and to maintain services. And what that means is, there's very limited, unfortunately, limited visiting hours, limited visitor restrictions. In the emergency department, for example, we have basically you can't come into certain areas, and that's again to protect people who are coming in, to protect our staff, and to allow us to continue to do what we need to do. Listen, we can't shut down the health system again. We can't stop doing what quote unquote elective surgeries. Getting a hip replacement in the minds of many is an elective surgery, but for the person who needs that hip, this is not elective. This needs to happen. Cancer does not stop because of COVID. Our patients need to have access to chemotherapy. They need to have access to the health system. They need to have access to the operating room to have those surgeries. And so while it is very real and the concerns are very real and we see the devastating effects of this virus, the general population maybe doesn't see that because we've shut down the outside view of what's going on in here. And of course, it does become political at times, but it's not political. This is science, and this is a virus, and it's very real. And that's basically all I have to how I can say it. But it's difficult. It's difficult, and I can understand how people would perceive it that way.
Mm. Thank you for that insight. We have just about 10 minutes, a little less than 10 minutes left. I do want to encourage our viewers to send in your questions. I'm joined this evening with Dr. William Tollefsen. He's our Vice Chair of Emergency Medicine and Urgent Care at South Shore Health. We are talking about COVID-19, particularly about testing, if you have any questions regarding testing. But Dr. Tollefsen's doing a great job answering a lot of other questions that people have about this virus that we still don't know much about. Jenny wants to know, how does an asymptomatic person who isn't coughing or sneezing spread the virus?
It's a great question. It's spread through mucous membranes. So think about every time you inadvertently touch your eye. You shake hands with somebody, you touch your eye, they touch their eye. There may be out to dinner or something like that, and people are take their masks off or in close proximity. Things we know that increase the spread of COVID-19: being indoors, being in close proximity, not wearing a mask, and exhaling. Think about churches, we think about singing, we think about sports venues. The hockey rinks were shut down for 2 weeks. Kids breathing heavily, doing athletics. These are all ways that this virus can spread.
Okay, all right. What is the recommendation about returning to work if you've tested negative for COVID-19 but show symptoms like a low-grade fever?
Yeah. Even if you're still having symptoms of influenza-like illness, the low-grade fever, you need to stay out of work. You need to quarantine yourself. But also, all that causes fever is not COVID. So you really need to reach out to your healthcare provider. You need to televisit, come to a South Shore Health Express, get seen, be evaluated. There's other things that are causing the same type of illnesses. If flu season's coming back, so we also have cases of influenza that are coming back. So these are all reasons that you should stay out of work, but you should also get evaluated. And again, while your test might be negative today, it'll be positive tomorrow. And that's where that viral load ramping up we spoke about before, about delaying a test until after an exposure. Well, if you're symptomatic, you're going to get a test, but you still have to remain isolated because we have seen serial tests that result in positivity.
Gotcha. So if you feel like you've been exposed and you wait a few days for that test, that doesn't necessarily give you license to be going about your business and work and grocery shopping and all of that. Stay home, isolate until you can get that test, correct?
Particularly if you're symptomatic.
Okay. Now, with the same advice obviously must go for parents at home who wake up in the morning and their son or daughter is suddenly coughing and has a fever. Oh my gosh, does he or she have COVID, or is it just allergies this time of year? Call your PCP, correct?
That's right. Call your PCP, arrange to get testing, particularly if somebody's symptomatic. Once if somebody in your family tests positive, then you're a close contact. So then you need to arrange testing. Just because somebody has a cough or sore throat doesn't mean the whole house has to get tested necessarily right off the bat. But testing needs to happen. There needs to be testing of close contacts. You have to stay home. You have to socially isolate. You have to wear your mask.
Okay. Megan wants to know, if someone gets sick a second time, is it more or less severe? What are you seeing?
We're seeing both. We're seeing both. We're seeing some folks who said they had it in April, that they knew that they had it and had positive testing, who got away without problem, and now are requiring hospitalization or come to the emergency department. So there's no pattern, and there's no rhyme or reason to this virus.
Okay. Are there any particular people, we've gotten several viewers who've asked this question, are there any people who should be tested frequently? Or do you only need a test, again, if you feel you've been exposed?
I think people who need to be tested frequently, there are populations who need to be tested frequently because they're at risk. I'm particularly our elderly, people who live in nursing facilities, people who live in assisted care facilities, who can't manage on their own, who are reliant on other people. And the same goes for the healthcare workers who work in those facilities. The carnage that we saw in the spring with our long-term care facilities was astounding. And now we have testing, and we have the ability to identify clusters and shut them down very rapidly because of surveillance. It's the same thing that we see with our university population, regular testing among those folks as well.
All right. Matt at home wants to know, is it possible to have COVID-19, to have it, but get a negative test?
Well, yeah, Matt. So, it goes back to what test did you get? So you could have had an antigen test or another type of test that has less sensitivity or specificity and still have COVID-19. Um, so there's other tests like we talked about the PCR test that can really find very, very sensitively, very, very small levels of virus that could find those early cases where the virus load is either ramping up or ramping down.
Okay. Amy would like to know, if you return from traveling, should you get tested right away or should you wait a few days?
I mean, it depends on if you're asymptomatic. If you are asymptomatic and you were traveling um, and perhaps know that you were at risk at a certain day or potentially uh, uh, were in close contact with somebody, not necessarily positive, but just you didn't wear your mask one day or something like that, then that's where the 72-hour mark might be good. But if you're asymptomatic, you practice social distancing during the entire trip. You need to have testing because you're returning from state mandates, and you'll continue to monitor you for signs and symptoms for the next 14 days. There's no time course where you really need to stick to for that.
Dr. Tollefsen, my last question for you this evening is, what would you like people to know at home regarding COVID-19? What should they be doing perhaps to protect themselves? Other than testing, what can they be doing?
I think, we see the incidence of the disease in our community, and we think about what we're seeing in the Midwest right now and in Texas with health systems overrun, and failures at social distancing and failures at mask. And I think in Massachusetts we're lucky we're doing that, and lots of people are doing that. And thank you. What we're struggling with today is the fact that we're all sick of this. We're all sick of this. The weather is changing. The holidays are coming, and we're tying that together with this increase in the incidence of the disease. So we need to stay strong. We need to not become complacent and focus on that social distancing, taking the tough road to skip Thanksgiving, skip traveling for Thanksgiving, to keep that mask on, and to really do our part so that our community can get over this and it won't turn into one of those humps that we're seeing in Texas right now, and our health system doesn't become overrun, and we can keep businesses open, and we can keep schools open, and we can keep moving forward. And quite honestly, we can keep schools open, and we can keep these businesses open with COVID, and it can be done, and it can be done safely or in a safer manner with a known perceived risk if we can get that incidence of the disease down, and we can all focus on our community and do it together.
Great parting words. Thank you so much, Dr. Tollefsen, for joining us this evening. It's been extremely informative. I want to thank all of our viewers at home this evening who sent in their questions. We had some really great ones. If you missed tonight's segment, you can catch it all on onehealthyboston.com. You can also see it on WCVB TV's Facebook page. We want to say a great big thank you to WCVB for allowing us to bring you this great content. And again, thank you, Dr. Tollefsen, for joining us this evening. Everyone have a great holiday, a great November, and please don't forget to wear your mask.
Thank you.